There have been no cases reported in our state of measles, but as other states like New Mexico and Texas are reporting more cases, it has many people wondering, especially parents.
Fox 61's Kay Pattyfoot talked to a doctor about the measles to learn what everyone should know to keep themselves protected.
According to the CDC, the measles, mumps, and rubella vaccination, or MMR, is the most effective protection against a viral infection. Children should get their first dose of the MMR vaccine anywhere between 12 to 15 months old.
We need to be cautious and protect ourselves. And fortunately, we are able to do that with measles because there's a highly effective vaccine available.
Dr. Ian Michaelo, Division Head of Infectious Diseases Immunology at Connecticut Children's Medical Center, says it's important that people are aware of what's going on right now when it comes to measles. Health officials in Texas have reported nearly 200 measles cases, including one deadly case where a child died. Officials say most of these cases, including that one death, were found to be school-aged children who weren't vaccinated.
The reality is that the numbers of children going into school who have been vaccinated is going down. And so in certain communities, if it's lower than a certain percentage, the risk for measles, when it's introduced into that sort of community or school, the risk of that spreading is very, very high.
Susan Trappy, a grandmother in West Hartford, is worried for unvaccinated children.
I think they're at risk, becoming ill and spreading the virus. So, I think people need to take it seriously.
Doctors say measles can be very contagious, especially if you're not protected against it.
If somebody has measles, they can infect up to 10 to 18 other people themselves, which is extremely contagious. So that's why it's so important to really get on top of this outbreak, because otherwise it's going to keep on spreading, and it finds its way to communities and to people who have not been protected by vaccinations.
Connecticut state law requires students born after December 31st, 1956 to provide proof of immunization against MMR.
I'm a pediatrician, and I believe it's very, very important to advocate for children, and this is very important, that they don't have the ability to request the vaccine. It's parents who are making the decisions for them. And I believe that withholding vaccines is not in their best interest or the society's best interest.
Dr. Michaelo encourages anyone traveling out of state, especially to areas where measles outbreaks have been reported, to make sure your MMR vaccinations are up to date. In West Hartford, Kay Pattyfoot, Fox 61.